So see, the perpetrator puts you into this position where you and I have a trust relationship. I'm going to do something wrong to you. And if you leave that or tell people, that breaks our trust. You see how that works? It's pretty powerful, for sure. It can look so pro-social and masked is so positive, but underlying the reason that they're there is not for what they're saying or what they're acting like or what. And that's why you'll see these cases where they're like, well, we had no idea. He seemed like he was just a nice guy looking out for this person or looking out for this kid. Or he seemed like a grandfather figure when the kid doesn't have any grandkids. I mean, yeah, they're very good at masking it and using sort of pro-social means to keep themselves in that position where they can have control over the victim. So there's an intensity of the involvement.
Yes.
It doesn't typically happen in most interpersonal situations because it is a breaking them down. Someone can be nice to you. That doesn't mean they're trying to perpetrate on you.
Right.
But when they're nice to you for 3 hours straight, that's a little weird.
Dr. Jeff Kieliszewski, you are a forensic psychologist. What does a day in the life of a forensic psychologist look like?
So forensic psychology is the application of psychological science to legal issues. So I work a lot with the courts. I'm a PhD, doctoral level licensed psychologist who went further on in my training and specialized in forensics. So if you use that definition that forensic psychology is application of psychological science to legal system, I work in courts and I do criminal forensics, which typically do evaluations for competency to stand trial, insanity, sometimes evaluations for pre-sentencing, for example, sex offender risk assessments for pre-sentencing. Also, I do some family law where I might be involved evaluating parents who are litigating custody and parenting time over children. I do a little bit of neglect and abuse if someone's children are placed in foster care due to neglect and abuse allegations that are substantiated. They'll need a psychological evaluation in order, as part of the treatment plan, to reunify with their children. I do some disability work. That's a legal issue as well. So if people have applied for certain types of disability. I do some probate law, which is guardianship. So someone needs a guardianship. I'll do a little bit of civil litigation of lawsuits and things like that. I do a fair amount of consulting. So a typical day for me can vary quite a bit. So for example, I might come in on a typical day, look at my schedule. In the morning, I have a juvenile competency to stand trial evaluation that takes a couple of hours. And then I may have someone who was referred through a child protective services agency because their child was removed. And then I might have a 2-hour block in my schedule where I'm consulting on a lawsuit. And then, later in the day, I might have to go out to a jail to evaluate someone for lack of criminal responsibility or insanity. And then there may be days where I'm called to testify in court. So it can vary quite a bit. Over the years, there are certain things I sort of change my interest and start doing more of, and then I can back off on others. So that would be a typical day for a forensic psychologist. If your practice is primarily forensic, you typically have to work in a lot of different types of law and different courts to really build a full practice with that.
Mm-hmm. And Dr. Jeff, you mentioned a sex offender risk assessment. What is that assessment?
Right. So many times the courts, if a plea bargain is made, for example, if someone is pled guilty to a sex offense, the court will want a forensic psychological evaluation to determine the person's risk for reoffending. And a lot of times the court will utilize that in the sentencing. Now, it varies quite a bit by jurisdiction here in the U.S., and can even vary county by county. Some prosecutors like to use it, some don't. For example, in Canada, pretty much anyone who gets convicted of a sex offense is going to have to go through a forensic risk assessment to offend. And these assessments are pretty technical. pretty complicated. There's a variety of factors that you look at. There are actuarial models that you apply in order to determine risk and then advise the court of the risk, and then the court can make a sentence based on that.
And that is risk of what exactly? Of reoffending?
Risk for reoffending. Mm-hmm. The idea would be that if someone has a high risk to reoffend, they would likely get a higher sentence to keep them incarcerated longer, to keep the public safe for longer. If someone has a lower risk to offend, that person could theoretically just be managed in the community. I can give you an example. When you look at the research on people who are called exclusive pedophiles, and that means they meet the criteria for pedophilia, they have a sexual interest in children and only children, they tend to have a higher risk to reoffend. On the other end of the spectrum, you will have these folks that expose themselves and get busted for a decent exposure. When you look at the research on those folks, that's actually very treatable. Most people don't realize that. So the idea would be, and this is particularly the Canadian, I practice here in the U.S. and Michigan, but in the Canadian system, their whole idea is we want to make better use of taxpayer dollars. So from a research perspective, if I see someone who's been caught exposing themselves, I know that's something that's very treatable. And with treatment, there's a low risk to offend. So it makes sense that the courts would likely want to manage that person in the community so they could go to their specialized treatment, their counseling, and they would likely be a lower risk to reoffend. And, bottom line is, why would you want to incarcerate that person for thousands of dollars a month when they can be managed in the community? So I've always pushed that it makes fiscal sense to do these types of evaluations, but some prosecutors have no interest in it, and they just want to throw the book at everyone, regardless of the type of offense or the level of potential risk.
So your risk assessment is breaking down sort of categories and then determining risk from those categories. Are there other factors as well?
Yeah, there's a lot of factors. So one of them is the type of offense. And, again, if you have a diagnosis of pedophilia, that in the research, you have to base everything on the science and research that will bump you up in your risk. But so you look at, there are all kinds of variables that you look at. And in the actuarial models, if you think of an actuarial model, insurance companies use actuarial models. They put all these variables into an equation and try to determine your risk, the age of the driver, right? Anyone who's had teenagers, they know if you have a teenage driver on your insurance goes up. Well, they use actuarials in risk assessment of sex offenders. Some great studies came out 25 years ago. And, they update these. But you look at certain, it could be age of victim can be a risk factor, age of offender. If offender has had previous criminal convictions for violence, that increases risk. Then you actually do, during the evaluation, you do a sexuality history. And you look at if there are any sort of problematic sexual behaviors or even problematic sexual appetites that have developed in this person's along their development of their sexuality, because these can be additional factors that could up the risk. So it's pretty complicated. There's a whole set of factors that actuarial based, whole set of factors that there are things called dynamic versus static factors. Dynamic factors change. If the person has a substance abuse disorder, that would actually an active substance abuse disorder, that would actually increase their risk to offend. So you have to look at all these factors to come up with an opinion of their risk to reoffend and a potential rehabilitation program if one would actually work. And you advise the court on that, and then they make their decision about the sentence.
And Dr. Jeff, we've talked about one of the categories. What are those categories?
Categories of offender?
Yes.
Right. So actually on my YouTube channel, I have a video that's called Type of Sex Offenders. I put it out probably 5 years ago. It's probably has 200,000 hits now, where I go through all that in detail. There's a lot of different types of offenders. You have people who offend children prepubescent. Those are pedophiles. They meet the criteria for pedophilia. You may have pedophile same-sex offender, pedophile opposite sex offender, the victim is opposite sex. All those load into different risk weights, you could say. You may have someone who has offended against a teenager, someone under the age of consent. You may have incest versus non-incest. You may have stepchild offending versus biological child offending. And then you can move into adult-on-adult sex crimes. There are folks who, you hear the term rapist. There can be different types of sexual assault. There can be violent sexual assault. There can be restraints used. There can be, for example, someone gives someone a rupee or drugs them and sexually assaults them. There can be what we call date rape situations. All of these factors are taken into account, and you can talk about a type of offender, but not every offender is the same. So, for example, you could have a certain type of offender, but there are all these other static and dynamic risk factors that you also have to put into the equation in order to make a determination of risk. Mm-hmm. I hope I answered your question.
Yeah. And I've heard you speak about grooming and how that works. Before we get into exactly how it works, are there particular types of offenders that are more likely to use grooming?
Oh, that's a great question. I'm not sure about the research on that. I will tell you, grooming is typically, most of the time, part of the scenario for sure, unless it's stranger violent sexual assault. There's no grooming there, obviously, but a lot of the sex offenders I see, grooming is definitely an aspect of it.
Mm-hmm. It seems that some people get the idea it's only with children, and yet from what I've heard, it seems that it can be used by adults and in all kinds of environments.
Oh, absolutely. There's a body of research, and the laws have changed over. I've been doing this a long time, and I remember when a lot of these laws weren't in existence were, for example, clergy. Mm. In some states, if clergy have sexual relationship with people in their congregation, it's considered sex abuse. If teachers, college professors, if you're in a position of power over someone, well, if you're a therapist or a psychologist and you have a sexual relationship with a patient, that's considered sexual abuse in most, if not all, states now. Typically, that will involve a process of grooming, for sure. And again, we can get into the definition of grooming, but
what is that?
Yeah, so the definition of grooming basically is a bit of a systematic approach in aligning or getting close to the alleged victim. It usually starts out as kind of being a support, developing a friendship, and then what happens is there'll be kind of small boundary violations that occur. And if the perpetrator gets away with these small boundary violations, then they can move into actually victimizing the person. And then they tend to sort of wrap that up with this idea that this is a secret. This is something special between the victim and the perpetrator. So they shouldn't share that or tell anyone about that. It's a whole psychological process, which really is based on sort of manipulating someone's vulnerabilities into developing what the victim sees as a close relationship, but the reality is they're just being used and victimized.
Mm-hmm. Yeah,
definitely
our listeners will
occur with adults or with kids, for sure.
Yeah, and I think our listeners will be interested in understanding that manipulation and how to spot it and defend against it and things. You have an excellent video that really breaks this down. And in my notes, you have different phases that you talk about, or steps rather. So there'd be targeting, gaining access, trust development, desensitization, and maintaining control. Could we start with targeting?
Yeah, so targeting will be that a perpetrator will typically look for what person could be more vulnerable to being abused. The classic example that we would see and seen many times is the child of a single mother. It's sort of a stereotyped example of they don't have a dad. This person's going to step in and be a father figure. And typically they're not even old enough to be the father. For example, the classic case is the guy who coaches youth sports teams. And I've seen a million of these cases. And I remember before I became a psychologist in my hometown, I was an athlete, and I saw some of the stuff and it turned out that there was abuse occurring. So you pick out the target. And the class, these are sort of stereotyped examples, but I've just seen them repeatedly. Yeah. Help the mom out. Oh, I'll pick the boy up from school. If you're going to go out with your girlfriends, why don't you have them stay at my house? So they pick out a victim.
Yeah, I know a woman who, when she was a child, she went through this. And the way it happened was she was in foster care, and then a guy with a 2-seat car came into the life of the woman who was sort of babysitting her, and he would take this woman, then girl, in his 2-seat car to places because there just wouldn't be enough room for other people to ride with him, and that was how he began to isolate her.
Right. Well, yeah, that's a great point. Isolate her. So, yeah, again, part of the grooming process is the perpetrator says, this is you and I together, and it's a special time. Mm-hmm. If a kid's vulnerable, they don't have two parents, or there's some problems in the house. I'll take you away from this. Let's go out to McDonald's. Let's go get you some candy. That's the way it starts.
Mm-hmm. So we're kind of moving between steps here. We've talked about targeting, and now we're talking about gaining access. Yeah. What else might gaining access look like?
Gaining access is, so you'll often see this, and again, we're using the example of a kid, where the perpetrator will always be available to help. The perpetrator, I've seen cases where the perpetrator has been signed on at the school that they can pick the child up at school. Another way to gain access is taking on an avocation, or an avocation where you have access to children. In fact, I did my dissertation on sex offenders of children that were incarcerated. And one of the variables I looked at was, do they have an avocation? Are they a coach? Do they volunteer at the church? I've seen a lot of cases where perpetrators will volunteer at churches in order to have access to victim, and that's how they gain that access. And they gain a level of trust as well because they're affiliated with the church.
Yeah. So when you say an avocation, that's some sort of role that lends itself to a certain authority?
Well, it can lend to a certain authority, but what it mainly does is it allows you access to potential victims.
Mm-hmm. And someone who's looking for targets would volunteer to take on this and step right into it and not need the compensation or anything like that.
Very common, the stereotype about the scoutmaster. I mean, how many cases have been in the media of that over decades? Yeah. That'd be an example.
And what I'm learning from speaking to you is that we can talk about this in steps, but really they're all running together, because the next one is trust development. But how much trust would you have of somebody in that role already?
Exactly.
What else can be done to develop trust?
Well, trust development, really it can really based on, I can depend on the perpetrator to help me out. So, for example, to get trust with the parents, to get trust with the child. Another way they'll do this is sort of be the listening ear for the child. You can tell me whatever you want. You can tell me things about your mom. That's fine. It'll just stay between you and I. You can trust me. They'll say that. You can trust me. Again, having a position, an avocation that gives you trust right away, that helps that process along too. But they'll really develop that, I'm a trustworthy person that you can depend on to the victim and to, for example, a parent.
Yeah. Yeah, and we're talking about this in children. I've seen this in adults too.
Absolutely.
And, one guy who I've seen, he would tell people things, people would start to confide in him, and then they'd say, but, don't tell anybody, or, something like that. He would say, don't worry, I used to be in the Air Force. I handled top secret information. I'm already compartmentalizing, and really reassure them, you can trust me. And that was one of his lines.
Right. Because what that trust sets up is once the victim understands that boundaries are being violated, now in order to report that, or in order to leave that situation, now you're breaking the trust. So see, the perpetrator puts you into this position where you and I have a trust relationship. I'm going to do something wrong to you. And if you leave that or tell people, that breaks our trust. You see how that works? Yeah. I mean, it's pretty powerful for sure.
Yeah. Dr. Jeff, the next step would be desensitization.
Yeah, so that's part of that boundary violations. So, for example, the perpetrator would first violate boundaries that seem kind of benign, touch the person more than they normally would. Could be, touching their back, arm, put their arm around them, then it's arm on the small of the back. So these minor violations. The other one would be verbal discussions. You see this a lot, particularly on the online perpetration. Somebody's talking to a preteen girl online, and they ask, well, have you had experience doing this or that yet? Grown men shouldn't be asking 13-year-old girls what they've done sexually. But they already have this trust, and then they do that small boundary violation, and then it gets bigger and bigger. And to the point where they move it into sexual behavior.
Mm-hmm. Yeah. And then the fifth step would be maintaining control. How does that work?
Yeah, that we've already talked a little bit about that. It's this idea that the perpetrator often builds that what we have is kind of a secret and special, and we just need to keep it between us. And then what you'll see is this kind of manipulation where sometimes the perpetrator can be kind of possessive of the person. Once the perpetration has happened, then they need to protect that, right? And how do you protect that? One way you can isolate, for sure, particularly with adults, you'll see that, where they'll isolate people from their support system in order to continue the abuse. That's when the perpetrator really has to work to try to keep this all under wraps. And there's a variety of ways based on whatever type of situation is, whether it's an adult, whether it's a child, whether it's a small child, whether it's a teenage child. They have to maintain that. I saw a substitute teacher that was abusing preteens. This guy would never take a day off. He would show up at all the kids' extracurriculars all the time. He was always there. And let's say one of the victims is at an extracurricular activity away from the perpetrator, and boom, there's the perpetrator. And now all those feelings that the alleged victim has. I trust this person, but they're doing this to me. I know it's wrong, but I really like this person. They really help me. So it brings in all those emotions. So the more they can make contact. So that's an interesting technique that I've seen of these perpetrators. They're there all the time.
Yeah.
They have to be there all the time to keep that control, because you're sort of keeping the victim in an emotional state where they're not likely to disclose or to separate from the abuse.
Right, and keeping all the attention on that person who's trying to maintain control of them.
Right. Yeah. I mean, it's a subtle way to control. They show up on the weekends that want to, oh, look, your teacher's here. Oh, that's so nice. No, they're not there for a nice reason.
Yeah. I've spoken with a woman on the show, Dr. Karen Mitchell. She's from Australia, and she's done a lot of research on how these things work, mostly in adults, I think. Mm-hmm. And she points out how the maintaining control tactics can be done in ways that look very pro-social. So it can be, I'm protecting someone, or, if it's a man abusing his wife or something, she's really sick, and, I wouldn't want her to be stressed out by being around you or something like that. And that's how he ends up isolating his wife from her friends, family, whomever. It can be masked as so positive.
Oh, and it's so subtle too.
Mm-hmm.
Yeah, like you said, it can look so pro-social and masked is so positive, but underlying the reason that they're there is not for what they're saying or what they're acting like or what. And that's why you'll see these cases where they're like, well, we had no idea. He seemed like he was just a nice guy looking out for this person or looking out for this kid. Yeah. Or he seemed like a grandfather figure when the kid doesn't have any grandkids. I mean, yeah, they're very good at masking it and using sort of pro-social means to keep themselves in that position where they can have control over the victim.
Yeah. Dr. Jeff, the best example that I've seen in my experience was a guy who had also trained as what's called a pickup artist. Are you familiar with this?
A little bit, yeah.
It's these guys who they get many repetitions at approaching women. They might live in a tourist town or something where there is a new set coming through all the time, and then they're always getting all these reps at approaching them and trying to very quickly escalate a relationship and things like that. And I see so many similarities here. I wonder, if you think about the differences between someone who's aggressively dating and aggressively approaching women and these sort of these situations that we've been talking about.
Yeah, I mean, what we're really talking about here is interpersonal manipulation. Mm-hmm. And the pickup artist guy, I know who you're talking about. And, they tend to be real aggressive. Mm-hmm. They don't care if they strike out. But what they do is every once in a while they'll find someone that connects with. Yeah. And then they exploit that connection in order to use the person, basically. Yeah. So it's interpersonal manipulation 101. Pickup artist versus someone grooming. It's all about finding the person in the situation that you can manipulate in order to use the person for whatever means you want.
And it seems that having, for lack of a better term, sort of a pipeline is very valuable too. Yeah. If you're someone who is, say, the school teacher, then you're around lots of children. For this guy who I'm thinking of, the pickup artist type, he sets up events that look very positive and pro-social again, but he's really using them to filter and to find who is that vulnerable person who he can target next. What can we look for in the social environment to know what's a great place to just be with people and what's a place where people are funneling for targets?
It sounds like a simplistic answer, but the reality is trust your intuition. Mm. If something seems weird, it's probably weird. Yeah. And if someone says, oh, no, the person who's trying to manipulate you, oh, no, this isn't weird. Yeah. It is weird. And trust your intuition. A lot of people don't trust their intuition. It takes some level of confidence to trust your intuition. In the perpetration on kids, I think it's better now than it was, decades ago. Common sense. 35-year-old single guys typically aren't super interested in hanging out with 9 and 10-year-old boys all the time. Unless it's their own kids or nephews, for example. They're typically not that interested. I love kids. But if it feels weird and looks weird, there's something probably weird going on there. Mm-hmm. I'm not saying the person is perpetrating, but I've seen lots of situations where it never got to the perpetration because the parent said, no, this is weird. You're not going to spend the night at your coach's house. Mm-hmm. Just you and him. Or you and him and another boy. I've just seen dozens of cases like that. So trust your intuition. If you're an adult and you're at one of these events and it seems sort of too good to be true and it feels weird, trust your intuition. You might feel like you look pretty good and you're desirable, but are you that desirable that this guy comes across the room, bypasses 10 people, and comes right to you? That's not typically the way social interaction occurs, particularly it's going to move on to a romantic or intimate level. Yeah. So if it feels weird, it's probably weird. So it sounds simplistic, but I think there's a lot of power in that.
I agree so much. That too good to be true thing
Yeah.
really resonates with me. The guy who I'm thinking of, I've seen him he's got a skill set, and he's a teacher in a lot of ways. And so he'll just meet a stranger and give them 3 hours of his time. And it just seems too good to be true. Why would he want to spend 3 hours teaching me? Because he's really using that time to break them down, to give them criticism and then praise, so that they become rewarded by him, so that he can put them into group chats and things, so that then he has this social proof, and he's giving them constant messaging in the group chat, so they're always seeing him, being aware of him. He's always on their mind. It's too good to be true, and it's really a funnel more than anything is what it seems.
You bring up a really good point, Brad, when you use the term break them down. Mm-hmm. So there's an intensity of the involvement.
Yes.
It doesn't typically happen in most interpersonal situations, because it is a breaking them down. So someone can be nice to you. That doesn't mean they're trying to perpetrate on you.
Right.
But when they're nice to you for 3 hours straight, that's a little weird. Again, that intuition, right? If someone hits on you, but they're hitting on you for 4 hours, or they text you 30 times in a day, that's a little weird. Trust your inhibition. I mean, your intuition, for sure. Yeah, don't trust your inhibition. Trust your intuition.
Right. Yeah, it's so tricky because, like you said, things are subtle and there are so many layers. So what I've seen too is that this guy is looking for personalities who are amenable to ideas like fate. And then he can warm them up as though it's their idea, like, oh, it's fate that we met. We have so much in common. We went to this place when we were younger. We both now live in this city. Isn't this amazing? And so people who are amenable to these ideas of, oh yeah, it's the universe bringing us together, then they want to get caught up in the story too.
And also it puts you in the position of the old saying, a leap of faith. Mm-hmm. Well, okay, it's kind of weird what this guy did, and I notice the way he's looking at me sometimes. But you know what? It's fate. We kind of met. There must be a reason, right? So I'll take this leap of faith and, go out on his boat. Yeah. Right? Does he have a boat, this guy?
He might.
Boat or the hot tub. That's another sort of
those
tool.
Are good isolation tools.
A tool that's used quite a bit for perpetrating.
Yeah. Yeah, the guy who I'm thinking of, it's funny. He's not so much looking for fast sex. It's control of people that he really wants, and so he's building a set of people to control. And that's another thing too, is that he can have a reputation in advance, because eventually, much like a cult, he can turn people into deployable assets on his behalf.
Yes, and
send those people to warm up a target. And so by the time he gets to them, he already has this aura, this reputation, and then he can play on that. And it doesn't seem too good to be true. It's, well, of course, this is who he is. I've heard about this from others.
That's what Epstein did.
Mm-hmm. Yes.
I think, if you looked at, I had a YouTube video on, I was involved in the Epstein story before he even got charged in federal court. I was hired to work on a docuseries. It eventually became Netflix, Filthy Rich, and we had a lot of information about him from a private investigator and from law enforcement before the federal charges, when he had state charges. And that's what he did. He had some victims, and then he eventually was able to deploy them to bring in more victims.
Yes.
So some of his early victims actually would befriend other girls at malls and things like that, and say, hey, I know this rich guy, and if you need some help, he'd be more than willing to help you out. He's a really nice guy. And so he was able to deploy the girls that he was abusing in order to go out into the community and find other victims. So that's a pretty common technique.
Yes, and it seems to work so well, because we want to trust people who are like ourselves. We want to believe if there's a crowd that around someone, that the crowd can't all be wrong.
Right. Oh, yeah. There's a bunch of social psychology going on there. Now, it's dissipation of responsibility. And if I'm in a crowd, and I'll just go along with the crowd rather than sort of stand up for myself.
Right. So, Dr. Jeff, when you are assessing people, what are you looking for to make sure that someone is okay to go? We've talked about, if they're a certain type, if there are certain risk factors, these actuarial tables. It also seems that perhaps you're looking for people who might use interventions as ways to just better understand the game and further enhance their manipulation.
All right. So your question is, what do I look at, or what do I look at or examine when I see someone to evaluate someone about how they use these games? Or
I'm wondering, what do you look for that might help you spot whether someone is going to use an intervention to just enhance their manipulation skills?
Oh, I see what you're saying. To basically set up a ploy.
Mm-hmm. Yes.
Well, right. A lot of times that fits in, again, with the grooming. The intervention is a tool, whatever intervention you'd like to use, that's your tool for grooming. So the intervention could be something as simple as, hey, I know that you're busy working, and if your kid needs a ride to school, I can do that, right? Or, I know you've been working hard, and, you can have him stay at my house Saturday night. That's fine. Get a break. And so the intervention is a tool for grooming and manipulating the person.
The interventions that people get when they're on their way out of the system, I mean, if say someone...
the treatment, basically.
Is being treated, yes.
Oh.
Yes. But
yeah.
I'm getting into the mind of the extremely deceptive, extremely dangerous person.
Yeah.
And for them to go to some sort of treatment would be an opportunity to learn the language, to learn the behaviors, and then to perhaps be more dangerous, yes?
Absolutely. So I can give you a great example.
Please.
When you look at sex offender treatment, and I was a prison psychologist for 7 years before I went into private practice. So I used to actually have to do sex offender treatment to people that were in prison. Part of the process was to do an assessment of whether or not they would be amenable to treatment. And, the Department of Corrections where I worked, they had, the procedure and the paperwork. And I was a new graduate, so I was kind of up on the research. And I read some great research on how sex offenders who are psychopaths, there's a great body of research on how they will utilize treatment in order to make them sort of a more well-armed opponent. So there's research about psychopaths going into treatment. Then they learn the language. They learn to say what what they think the mental health clinician wants to hear, to demonstrate some behaviors that would present that they are reformed. Okay. So when I was working in the Department of Corrections, and I had to do my screenings for the sex offender treatment program, the only way to get paroled was to successfully complete that program. And this was in Michigan, where they had indeterminate sentences. So you could come in on a 10 to 20-year sentence. That means you're going to do a minimum of 10 years, maximum of 20. So you'd be eligible for parole around 10 years. What I did is I had training on how to assess for psychopaths. It's called the Psychopathy Checklist by Robert Hare. And it's empirically validated. It's a great instrument. I went to a training. He gave the training. So when I would see things in the file that would make me concerned that this individual was a psychopath, I do the psychopathy checklist. And they would get a score. And then I would deny them treatment. And then they would appeal it. And then I'd have to go in front of the administration. And I'd say, here's a psychopathy checklist score. Here's a bunch of research on how if we put him into treatment, it's going to make him more dangerous. There's good research on it. So I said, so I'm not accepting him in my treatment because I don't want to turn out someone who's more dangerous. Never lost an appeal. Right. and then I'd write it up that way too in the report. So when you find someone who has psychopathy, they will utilize treatment interventions in order to become a more well-armed opponent, and it actually makes them more dangerous because most of these guys will be released. So I didn't want to be involved in an intervention that made someone more dangerous. And again, that worked every time.
Yeah. I'm curious about how that research would even work. Would you assess a sample of people, find who the psychopaths are, run them through treatment, and then see who reoffends and who is more sophisticated in the future?
Yeah, so some of the earlier research on the psychopathy checklist was done in the prisons in Canada. And there's a bunch of great research based on even that psychopathy checklist score, how likely they were to reoffend. Mm-hmm. But the idea behind they will utilize things, that's more of kind of a qualitative analysis of how. So, for example, these guys with a high psychopathy checklist score would come out and they'd do this treatment, and they'd look great on all the treatment. They could say what they were supposed to say to look good, and they'd be in treatment, and the notes from the therapist on their progress in treatment were like excellent. Some of these guys would lead treatment groups within the treatment facility. Yeah. And then they'd get out and they'd reoffend. So what we found is there is some research that talks about the ones who successfully completed treatment and have psychopathy were offending higher than the ones who didn't have treatment but had psychopathy, if that makes sense.
Yes.
So that's kind of evidence that, did they get more confident in their ability to offend after they knew all the language? Again, it was another tool or technique that they would be able to try to utilize. They also, I've seen cases where, so these guys would talk with the police and they would be able to talk in a way to try to convince the police that it was a false allegation. And a lot of times the cops would run their history and say, oh, they've been to prison for sex offending. Well, they're going to assume that something went on.
So it sounds like the psychopath who gets the treatment is basically getting an inside look at what people are expecting and then can become a better actor.
Right. There is also some research on, it's not psychopathy, but antisocial personality disorder. Mm-hmm. And like you said, you do a lot of stuff on personality disorders. There's some research that talks about how these people, for just general regular mental health treatment, it actually makes them more likely to continue their antisocial ways because, again, they've learned the language. They have a new tool in their toolbox on how to act out and manipulate or cause crimes in society.
So in the way that we're talking about this, it seems that the psychopath, the person with antisocial personality disorder, they're actors. They're presenting a front. There's that great book, The Mask of Sanity, this idea that they put up a front, but there's something different behind it. What is your definition of a psychopath?
Well, first of all, I'm really impressed. The book, The Mask of Insanity.
Oh, I spend a lot of time on this stuff, Dr. Kieliszewski.
Yeah. Cleckley? I think Cleckley.
Yes, Hervey Cleckley.
Yeah. Wow, that's impressive. I haven't heard that in a while.
Thanks.
So what's my definition of a psychopath? The best way to describe a psychopath is basically that these are people that do not have the same or typical connection that most of us have. They don't have typically an emotional response to humans. So let me give you examples. People always talk about why can a psychopath killer cut a body up? For a psychopath killer, cutting a body up is like cutting their chicken sandwich in half at lunch. There's no emotional connection. If most of us were tasked with dismembering a body, it would probably make us upset. They don't have that. There were some great studies that came out probably in the 70s where they tested people for psychopathy, and then they put them in a little movie theater. And they would put words up on the screen that were typically emotionally laden words, and then you'd hear it. These would be things like, disparaging racial comments, racist stuff or violent stuff. We know we can test your brain and see when you have a physiological response to certain words, because what happens is that word goes into your brain attaches an emotion to it, and you have a physiological response. Psychopaths didn't have that response, and it freaked the experimenters out. They couldn't believe it. So they would put them in a room, put up these words that would, for most people, elicit an emotional response. But you could be sitting back and go, I know that word. That doesn't bother me. But your brain had a response. Psychopaths did not have the response. So they don't have the emotional response to human beings the way that most people do. To psychopaths, people are objects.
Yeah.
Again, how could a psychopath cut a body apart? It's like cutting a piece of wood apart. They have no feelings or connection to that. They can fake feelings, but they don't have the same connection, human connection, that non-psychopaths have.
It seems the power to fake feelings is really the skill of a successful psychopath.
Yeah.
And I've heard things anecdotally that they seem to gravitate to things where they are sort of performers, acting, dance, figure skating, these kind of things. Any evidence to that, or what do you think of that?
Oh, right. So, just by presenting social skills or faking empathy or faking emotion, they can express emotion. They just don't have, at a biological level, the feel for emotion that most of us have. So and again, this becomes social skills. So they can fake emotion, and this helps them socially, because most of us have emotion. We express emotion. They express emotion. They don't feel it. They express it, and that helps them socially, and it can help them to manipulate people as well.
Mm-hmm. Yeah. And I mentioned earlier the work of Dr. Karen Mitchell. Something else that she found is that because they don't necessarily emote like the rest of us, sometimes it's mistaken for gravitas. And we think, this person is, what an authority. He's so cool under pressure. And then it's one more thing that actually makes them effective at deceiving people.
Oh, for sure. A lot of times folks who are psychopaths, others see them as calm, cool, collected. They're not calm, cool, collected. There's just no emotion. And this can absolutely be interpreted, particularly if they're in a position of power, can be interpreted as something that's positive about them or a strength about them. When again, people are interpreting their presentation through the lens of the way most of us emote and think. Mm-hmm. But psychopaths are different.
Right. And then another trouble with this is that if they're manipulating the people around them, those people can become very upset and eventually become stressed out, sick from the manipulation, and appear to be out of control. So then the psychopath looks good by comparison too. If say a psychopathic husband is abusing his wife, she could look distraught,
right,
while he looks chill.
Oh, right. And that's a great technique too, right? Because if your victim seems distraught or not mentally stable, and you're the stable one.
Yes.
Right?
Yes.
They're not going to believe her.
No.
Because you're the stable one. They're going to believe you.
Yeah.
Again, and when you're viewing as a non-psychopath person, you're viewing it through that lens. And thinking this person's just calm, cool, collected, together. But they just don't have that emotional. Their lens is very different than yours, for sure.
So, Dr. Jeff, if this is a lack of emotional connection to people, what do you think makes for that lack of emotional connection in the first place?
There's a lot of controversy about that, right? Mm-hmm. Because we know when we've studied psychopaths, some of them grew up with horrific abuse. So the theory is, they just dissociated from human emotion. But a lot of them grew up with nurturing parents and regular, typical households. My hunch, and there's no scientific certainty to this, my hunch is that there's something biological that's sort of missing in the brain. Mm-hmm. Do we have psychopath animals, right? Because when you look at, are there any biological substrates? One thing when you study when you study neuroscience, one thing that gets interesting, and particularly neurobiology, is sometimes sort of, and it sounds simplistic, but sometimes certain things don't get hooked up in the brain. That makes sense. Mm-hmm. We think about an example would be adolescents, right? Adolescents, their frontal lobes aren't really connected yet, right? Not fully developed. So they can think about really dumb things to do, but they have no idea about the potential consequences. So that part of the brain's sort of not hooked up yet. I suspect, this is my own Dr. Jeff's hunch, that something in the brain did not connect, because biologically, it makes sense for us to have compassion for others, to have nurturance and caring abilities for others, because that keeps the species alive, right? But for psychopaths, I suspect, and we don't have, maybe, I don't know if it'll be in my lifetime, but maybe at some point we'll be able to do neuroimaging or some type of analysis of neurological systems in the brain to see why that is not working or not hooked up right, if that makes sense.
Yes. Yeah, and this is putting nuance on this question that I've been working through with a lot of professionals that I've interviewed.
Yeah.
And one thing that we could say is that your connection point is really big, because there are things like there are a number of studies about how maybe there are differences in the structures of the brain. Some things are
right.
smaller, some things are different. That's well cited in.
Yeah.
There are books that bring that up. I haven't read the studies, but I've read books that will cite studies, Women Who Love Psychopaths, Snakes in Suits by Robert Hare, that point to these things about brain structures. But then I talked to Dr. Gwen Adsed out of the UK. She's a forensic psychiatrist. She was saying, well, the brain doesn't just work in this modular system. This brain is this whole connected thing.
Right.
So we want to have more flexibility about how we see the brain structure element. But your point to the connection, if there's a difference in the way that those elements are connected, that is very interesting.
Yeah, but the brain runs on systems. Mm-hmm. We have certain centers in the brain that are more, when I was a professor, you used to talk about this. It's not that this part of your brain controls this. It's this part of your brain is implicated in this. Mm-hmm. So just memory. If I hear a word that goes into my brain, it's visual. If I hear it, it's auditory. If I see it, it's visual. It goes into certain areas of the brain. One looks at what one is highly implicated in visual processing. One's highly implicated in auditory processing. Make sense of that. And then all of a sudden another part of the brain comes out, and that's sort of the emotional part of the brain. Do I have an emotion associated with that particular word? And then a part of the brain comes in called the memory. And parts of the brain are more heavily implicated in memory, because we know when they get damaged, you can't remember anything. And it'll go in and go, oh, I remember an experience I had that is related to that word. So again, the brain is systems. Mm-hmm. So let's say, theoretically, a system that's involved in empathy. It's going to be more than one system, by the way. It's going to be a bunch of systems. And there's going to be some biological elements to that too, if that's disrupted in some way. Then does empathy not come online? If that makes sense. So yeah, the person you talk to, that's a great point. It's just not there's one component or one little part of the brain that is responsible. There are various systems in the brain that interact in order to make meaning for us, in order to help us deploy certain behaviors or even deploy emotional responses.
Mm-hmm. We're leaning into sort of the nature side of this nature-nurture discussion. You did briefly talk about the nurture element, that there's evidence that some psychopaths go through very rough childhoods.
Yeah.
Could that affect the connection structure that you're talking about?
That's a great question, because we do know that there are studies, particularly with PTSD, that there are, and these are newer studies. There's always been theories and people suspecting this, but some newer studies are coming out that talks about how sometimes traumatic experiences can affect your neuroanatomy, for sure. And that makes sense to me, seeing people over the years who have PTSD, for example, from childhood trauma. Because the reality is, from a treatment perspective, people never get cured of trauma. They just learn how to get past it and learn how to cope with it better. And then it affects them less. So that would really kind of fall into that argument that there can be some fundamental changes in either or at a biological level in the brain when exposed to trauma. But from a practical perspective, one thing that fascinates me after all these years, I can see people who go through similar circumstances, similar traumas, sometimes kids who've all grew up in the same home of abuse, and they will frequently take sort of different paths and how that affects them. The majority of people who go through abuse in childhood don't have PTSD, but some do. Some go through some pretty horrific abuse and they come out, I wouldn't say unscathed, but they don't have PTSD. Some people go through, we might look at the situation and say, well, yeah, it was bad, but not that bad. But they're wrecked. Some people go the personality disorder route when they grow up in for example, a house of abuse and neglect. They develop these personality characteristics early on in life that work in that situation they're in. But when they become adults, these can be aberrant traits that cause problems. So the nature versus nurture, I'm fascinated where some people can come out of traumatic events and it affects them in one way, and another person can come through a similar event and it affects them in a profoundly different way. So again, it's an interaction of nature and nurture, but we do have a lot of research evidence, particularly now, that there can be some fundamental structural or biochemical changes in the brain as a result of trauma, no doubt.
Mm-hmm. So Dr. Jeff, if trauma could cause things like psychopathy, narcissistic personality disorder, would trauma therapies then cure them? Or you said you don't cure, but would they then resolve the trauma and then resolve the psychopathy, the narcissistic personality disorder?
I think it's more than just they had trauma that made their psychopathy.
Yeah. So we can
most people don't,
because I don't hear of trauma therapies working for things like NPD.
No, that's why I think, this idea where you're born a psychopath, I would probably fall more into agreeing with that category. Mm-hmm. You were born, I would argue, and again, I'm not a total scientific expert on this. I'm not a brain neuroscience person. Or I shouldn't say I'm not a neurologist, right? I studied neuroscience. I do some neuropsych, but there are people that could speak to this more than me. But I suspect that when they were born, there was something that was missing, a system that didn't work properly or connect properly in the brain, that would help that person develop a more typical sort of emotional process or center in their brain. And then they get into an environment already having that biological makeup, and then that environment can shape how they utilize or deploy that makeup. So if you were born, let's say you were born a psychopath, but you're in an environment, and you ended up in an environment where there's a lot of neglect and abuse and a lot of bad things happen. You learn how to do those bad things, and you learn how to use those. And then when you become an adult, that's the way you navigate your world, right? Let's say you grow up and you've got sort of that you were born with that psychopathic brain, but you grew up in a really nice home with parents who had good means and no struggle, and you became a surgeon.
Yeah.
Because we know that when we look at professions, surgeons have a lot of psychopaths. Yep. Now, are they out terrorizing the world? No. Would you want your surgeon to be a psychopath? That was a question I used to ask when I taught this as a professor. You might want to. You know why? Because when things are going wrong, they don't get emotional. It's all a technique. So we could get into, in my family law cases, a lot of psychopathic surgeons and their divorces, but that's a whole other podcast because I have a lot of those too.
I bet. Yeah. This idea of the environment shaping it. So I've also spoken with Dr. Robert Plomin, who's a behavioral geneticist. And one thing that we got into is that perhaps the psychopath is born, and then we say, oh, well, their parents were so tough on them. But if your child is a young psychopath, it's very likely that a parent is going to struggle to deal with that child, and they may seem a very harsh parent. And that psychopath has the story, my parents were so tough on me. But how else do you deal with them, if you don't know what you're dealing with? I wonder what you make of sort of a feedback between the parent and child that makes this story that the child is abused when perhaps the child is born that way?
Right. So, if we assume that the child is born a psychopath, do they exhibit antisocial behavior is really the question. Mm-hmm. You might have a child that's born a psychopath, but they can kind of get what they want or need, and this is met through pro-social behavior, right? They learn good social skills. And we always think of a psychopath as evil, which is fair. But there are a lot of psychopaths who are not evil and causing crimes. They don't have that emotional connection to people, and people might be objects, but they don't participate in antisocial behavior per se.
What do you think makes that that more antisocial, maybe sadistic nature?
Tough question. Again, if you're born with that psychopathic brain, and then you get exposed to sadistic things, you sort of learn, oh, this is the way you navigate life. You act sadistic. You do bad things. So they can sort of learn it that way. I guess what I get a little worried about now, particularly with how much access we have to the world and social media with our computer in our hands.
Yes.
And I'm seeing this a little bit in my practice now. When someone has an inkling or a thought, they can go on their phone and find stories about other people who've had that inkling and thought. What worries me is particularly when I've done evaluations, this is particularly salient when I do evaluations for kids who make threats at school or are developing plans in order for a school shooting or something. What they do is they have this thought and this idea, and then they go online and they research it. And they learn about it. So if you're a psychopath and you have an interest in violent sexual assault, there's plenty of ways to learn about that. That doesn't really necessarily involve trial and error at first. Mm-hmm. So they can go, true crime is a gigantic genre all over the place, right? It's in the news, it's movies, it's TV. Now it's reality-based. We used to call it reality TV. It's now reality online, right? Mm-hmm. They can go find these things and learn about them. They can sort of, and I've talked about this in some of my videos, where they can sort of utilize fantasy. What would it be like to do that? And they can feed that fantasy by consuming things that fit in with that interest that is maybe destructive or sadistic.
Yeah, the fantasy thing is very important too. Talk with FBI profiler types, and they'll say, that the fantasy, changing the fantasy can often help to change the behavior, but it can also be what spurs the behavior. So if managing the fantasy is extremely important too.
I've heard someone I used to work with years ago who did a lot of work with sex offenders. He talked about how fantasy is a practice, and it's practice without consequences. And it really fit into the whole idea about particularly offenders, sex offenders of children, where now they can utilize child porn much easier than they could 20 years ago. And what you'll see is they'll utilize child porn to feed that fantasy of what would it be like if they had that experience. Unfortunately, what happens is they get satiated on the child porn. And it doesn't give them the payoff. It doesn't feed the fantasy as much anymore. And then they kind of move into actual real behavior rather than fantasy. So fantasy is a way to practice a behavior, if you think about it, to practice a behavior without any consequences.
Mm-hmm. So Dr. Jeff, we have talked a lot about psychopaths and narcissistic personality disorder. What would you say is the distinction between those two?
So, well, first of all, narcissistic personality disorder is a diagnosable condition, really. And narcissistic personality disorders, they can have an emotional connection to people. They absolutely do. Oftentimes it's kind of a dysfunctional emotional connection, but they have the capacity for emotional connection, if that makes sense.
Yes.
Psychopaths do not have that capacity for emotional connection like most of us do, and like narcissistic personality disorders can.
Okay. And you said that narcissist, what was the first thing you said?
Narcissistic personality disorders is a diagnosable condition.
Diagnosable.
Yeah.
So the hair psychopathy checklist, not a diagnosis?
Right. So psychopathy is not a formal diagnosis. They tried to get that into the DSM for many, many years. At that time that they were trying, they really couldn't, they didn't really have the research base. And then I think that attempt or that drive just sort of went away. I think Robert Hare kind of gave up on it. But I would argue it is very much a clinical phenomenon and condition, even if it's not diagnosable or it's not. So we know what it looks like. We can measure it. I think it should be a subset of antisocial personality disorder. That's just my 2 cents. But I don't think anyone's taking up that battle right now.
Mm-hmm. So, Dr. Jeff, the narcissist can have more of an emotional connection to other people than the psychopath, who you said could cut up a body and not even notice it.
Right.
What makes the narcissist more likely to commit murder?
That's a great question. And boy, I think I did a video on that too, narcissists who murder. And because it seems like a lot of the television shows and YouTube channels that I've been on, we talk about narcissists who murder. So one of the, a couple of a couple of things with narcissism, narcissists who will murder. Narcissists have such an inflated sense of self-worth. They feel like whatever they're doing is the right thing to do, and they can even justify it in their own mind to take someone else's life as fitting in with what they want and what they need, and that means the world should bend to that. Another big thing with narcissists, and this gets them caught all the time, is they think they're smarter than everyone else. They think they can outsmart the police. So we have this very self-centered person who thinks they're smarter than everyone else and everything they do is right. And I'm so wonderful, how could anyone even suspect me? So I don't know how many cases I've been on Nancy Grace where we have the narcissistic husband who murders the wife. A bunch, because they think their needs are paramount and above everyone else. So whatever means to get their needs met, sometimes it moves into murder, but they really have this false confidence that they're not going to get caught because they're smarter than everyone else. And why would people suspect me? I'm so wonderful anyway. And that ends up becoming their downfall. I talk a lot about that in the video.
Yeah. So they have this idealized self, and then it seems they'll go to any lengths to protect the idealized self and assume because of the idealized self that everything will work out.
Oh, yeah. Yeah, they think everything will work out. They think they'll get away with it. There's all these stories that I worked on TV shows just keep coming through. Yeah. It's so common where you'll see these narcissistic husbands murder their wives, particularly if they're going through a divorce.
What would be an example?
Well, the example would be I had one that I worked on. I think it was a TV show. This guy was this bodybuilder type, good-looking guy, but obviously was showing off his looks constantly, having numerous affairs. His wife made most of the money, spending all the money. He was, and he killed his own wife. And when the police questioned him, I've never seen someone so confident in trying to convince the police that someone else did the murder. And the police just let him talk, which is a great technique with narcissists. You just let them talk, and they will talk, and they'll tell you a lot. So that particular case, the guy was the quintessential sort of alpha male narcissist who thought he was smarter than the police. But, they caught him and he's doing life. I don't remember where it was, but that was a couple years ago, that particular episode. So, but it is interesting that the narcissist gets to the level where they think murder is justifiable.
Yeah.
Maybe you've covered this in your other programs, but the history of narcissistic personality disorder, when it first came out, they used to call it a psychosis because they said these people believe things that are not based in reality, like how wonderful they are. I think they used to call it narcissistic psychosis when it first came out in one of the early versions of the DSM, because it's like, really? You really believe that? That's not reality. So it's kind of funny how that, when you study the history of psychology and psychopathology, you get into those cool old writings about that stuff.
Yeah, the delusions.
Yeah, it's a delusion. They're so wonderful. You're not so wonderful. You're delusional.
So, Dr. Jeff, we've established the differences between narcissists and psychopaths, and yet there are narcissistic psychopaths as well. There are some who are both. What traits dominate, or is it sort of picking a little bit from here and there, a buffet?
Right. Again, so at the base level, right, the psychopath doesn't have that connection to humans. The narcissist has this idealized self, this aggrandized idea of who they are. They're overconfident. They tend to be socially skilled. They're very focused on their own needs. So that is a very dangerous combination. We know, and you probably covered this on narcissists, can be very good interpersonally manipulating others. Well, that just fits really well with a psychopath who can just use you. A psychopath doesn't, a narcissist will justify him using you because this is what I want and I'm wonderful and I deserve it. A psychopath will be, I'm using you just because, well, I'm going to use you for this. So that's a dangerous combination for sure.
So it's the lack of emotional connection to other people of the psychopath carried into a person who has the delusions of the narcissist.
Yeah.
Melded together.
Very dangerous character for sure.
So it seems that things like personality disorders get thrown around a lot these days. It seems everybody's saying everybody's a narcissist.
Yeah.
What do you make of the rate of diagnosis, of the popularity of these ideas?
I think we're good right now on personality disorder diagnosis because I think a lot of clinicians understand that you have to be very careful before you put a diagnosis like that on. Now, someone can be narcissistic, but not a narcissistic personality disorder.
Yeah.
And there's levels of narcissism, right? And in fact, in my practice, we had a corporate psychologist for a lot of years, and he used to do evaluations for executive selection for companies. He wanted to see a little narcissism, a little, not too much. And this person who's going to lead a multi-million-dollar organization. It's an overconfidence. So, so some of these narcissistic features can be helpful or positive, but when it gets to the level of a narcissistic personality disorder, I think the criteria is very good. And for me, I rarely diagnose a personality disorder after one meeting. It usually takes a while. And you have to look at all the collateral information that this is a characteristic that's wrecked or caused problems in their ability to have relationships, their ability to work, their ability to move towards fulfillment. It causes dysfunction. And that's where it gets to the level of a narcissistic personality disorder. And it's pervasive dysfunction. Personality disorders have problems at work, have problems with their family, have problems in relationships, have problems in friendships. They have problems, it's pervasive. And that's the difference between a personality disorder, like a narcissistic personality disorder, versus someone who's just a narcissist. They might be a narcissist in their relationship, their crappy partner, because they're a narcissist. But they do pretty well at work, and they do okay with their kids. So that's the difference, the pervasive dysfunction versus if you're a narcissist, you're going to have some problems, probably with a few people.
Mm-hmm. Yeah. Well, Dr. Jeff, I appreciate you putting so much nuance on these things. For people who want to learn more about you, before I ask my last question, where should they look for you online?
So I'm on all the social media outlets, TikTok, Facebook, Instagram, and X. The main thing where I have a YouTube channel Dr. Jeff Kieliszewski, forensic psychologist. Hopefully, maybe in the description, they'll find my name so they can spell it. And I keep trying to keep up that channel. I enjoy doing it. It takes time, though. But I get a lot of great interactions with my subscribers. They send me questions. I'll do videos on the questions. I enjoy it. I wish I had more time to do it, but I have a pretty busy practice. But that's the best place to find me. If you have any interest in forensic psychology, all the way from things we talked about today, narcissistic murderers versus how do you become a forensic psychologist. I cover a variety of topics in forensic psychology from the perspective of someone who actually works every day in an office as a forensic psychologist, not just an academic. And hopefully, people seem to respond well to the channel. I don't get too many haters, so check me out there.
Good. Well, we'll put links in the description for people to check out. And Dr. Jeff, my last question is really about that work that you do in media, YouTube, television, things like that. What do you hope that people learn from you?
I like to pass along the knowledge, particularly based on my experience. I know all the research. I've read the books, but to connect that to my experience. So when I go on these television shows, I try to help people connect these academic or intellectual concepts to what really happens in the real world. Because we know there's a lot of sort of psychobabble out there, a lot of glamorized or fictionalized things in psychology, and particularly forensic psychology and true crime. So I try to really make that connection between what the research says, what really happens in the real world versus what you might consume in some of your media or your fiction.
Well, thank you so much, Dr. Jeff, for doing that, for making the media that you do. Yeah, that's my pleasure. And for taking this interview. I really appreciate this.
Oh, no problem.
To help raise awareness about narcissistic abuse, please share this video. It helps a lot.